So I thought we'd do just a few of these short 8 to 10 minutes of me walking you through these various chapters. I do understand that reading for some can be quite dry, and especially when you are in your first term and first week. So as you'll learn with the various courses you take with me, I do throw in some audio guides for readings to help you in your understanding of the various terms and areas related to physical therapy, interventions, and practice. Specifically, I'm right now on Chapter 2 and looking at page 24, and I want to really start out this term with understanding the various roles of the physical therapist, because this is the chapter specifically on those who will supervise you as the primary care providers, and you will be the support of the physical therapist in the provision of care, specifically the intervention piece, as assistants. And you'll hear that constantly throughout PTA 100, through PTA 101 and 103, and specifically by the third term, by next spring, you should have this down pretty strongly, or at least have it down with a lot of confidence as you prepare to go into patient care next year. So you want to know, what are the roles of the physical therapist? That is the objective for the week. I wouldn't split hairs about primary, secondary, tertiary, meaning that don't expect me to just throw in a question. So give me an example of tertiary care for the physical therapist. No, how the author breaks this information down, as you see in page 26, is the primary care role that a PT may have. I'm not saying they will have this, but they may have this, that they are responsible for the majority of the health needs of the individual. So if someone has seen a physical therapist without seeing a doctor, and without being referred to the doctor, and is getting care via direct access, that would be an example of primary care. They're not getting care from somebody else for their medical problem, whether it's low back pain or a problem related to an ankle sprain. Secondary care is provided by clinicians on a referral basis, so that would be a doctor referring a patient to a physical therapist. That is secondary care. And then tertiary care would be facilities focusing on specific health conditions. So let's say there's a specific burn center, for example. That would be an example of tertiary care. So I think that breaks that down pretty well. And I think what this information does is just helps you appreciate, or at least learn, the various roles of the PT in this chapter. So there are several events that take place regarding management of a health condition regarding a patient, and 27 and 28 pages, I think, really well kind of break this information down. That and this is in order, sequentially, as an algorithm. There's a really good picture in 2-1, and so the start is the examination, where the PT examines the patient. Certainly the patient is coming in and has had some level of examination, such as medical history of the patient, employment status, histories, functional status. So all the system review is part of what the PT starts to look at before they even take a patient through the various tests, which is part of the evaluation. where the PT in the evaluation and from the conclusion of the evaluation comes up with a PT diagnosis. At this point, I don't want you to split hairs and memorize every single component of the evaluation. That is not the goal this early in your education on week 1. But it is familiar that an evaluation is done, as you see in Chapter 2. This chapter is about the characteristics of the physical therapist. Only a PT can evaluate a patient. And that's really important to always have that communication and link with your patients. It can get confusing with them sometimes because they see you sometimes more often than the PT, and they need to be reevaluated, and they ask, well, why can't you do it as a PTA? Well, it's because it's not in your scope of practice. So following the evaluation, the PT comes up with a diagnosis. I do not want you to memorize everything in Table 2-1. That is too much, and you haven't been exposed to terms such as cranial peripheral nerve integrity yet. So I think it's good to look at these terms and to at least kind of make some connections, such as when you're looking in Table 2-1, integumentary. Integument means health of the skin. And as we get into physical therapy practice, you'll learn more about the integument, as well as when we work together more, or you with Susan or Abby in the Table Rock campus, when it comes to promoting good skin care in the discussion in PTA 101 lab, as well as lecture with Christina. So kind of moving on, and then as far as continuing with the prognosis of the PT states, we have 6 weeks at, in their assessment, his or her assessment, that the patient will be able to, for example, lift up their arm overhead in 6 weeks if the patient has a shoulder problem. That could be a prognosis. So again, the timeline involved in the prognosis. And then you have the intervention piece, and that's where you are involved as the PTA in the intervention piece. The collaboration between you and the PT provides interventions as well as yourself. So that is where you're involved. And then finally, there's the outcome piece, and the outcome is the resulting interventions in the entire plan of care. Now, as a PTA, you can collect data to help determine the outcome, but ultimately the PT is deciding whether that patient continues to work with your team, meaning you and the PT, and extending that prognosis piece, or decide to do a re-evaluation or examination because of a new health condition, perhaps, or something that you and the PT or the PT alone have discovered in your interventions. That is a new condition. And or, again, you can decide, not you, but the PT decide to discharge that patient, that the goals have been completed. And to reiterate, you are part of gaining data or gathering data in many cases to help with that determination of outcomes, which is ultimately made by the physical therapist. So I never think there's a typical flow of things, but if there's no complications, the outcome would be hopefully that the patient met all the goals established by the PT through the interventions that you and the PT have been provided, and they're successfully transitioned on. So I hope that helps with this section. I think I've answered some of the questions already, and we'll do another one of these as well in this lesson builder. Thank you.